ahead, Vidyasagar.
Good morning to everybody. Thank you, Dr. Chanak sir, and all my colleagues. So I am going to talk about humidity and its effects on C-arm. When I had, first of all, let me start with the definitions, understanding what is humidity, what is moisture. Humidity is the state of air when it is full of water vapor, so you feel it basically. It is divided into two types, that is the relative as well as the absolute humidity. It is a relative to the temperature of the air, whereas absolute is regardless of the air temperature. Warm air means more water vapor and it causes lower relative humidity, whereas cold air is less water vapor and it causes higher relative humidity. Moisture is the condensed or the liquid form which we can see on the surfaces basically. So what are the sources of humidity in the OTs, in our operating theaters? Most important is the OT room personnel, doctors, perspiration, water spillage caused during the surgeries, especially arthroscopic surgeries or surgery which require a lot of water during the surgeries. Like general surgery also, it has got a lot of water usage. Water seepage in OT. What I found for my particular OT was water seepage. There was water seepage for a particular wall, which was the cause of the moisture and the humidity as well as the humidity in the OT. Improper drying and cleaning is one of the most neglected things after fogging. And also, environmental temperature plays a big role with regards to humidity in our OTs. So what are the acceptable limits of humidity? As per the revised guidelines of NABH 2018 for air conditioning of the OTs, these are the guidelines given by NABH with regards to temperature as well as relative humidity. The temperature has to be maintained around 21 degrees plus minus 3 degrees. And specifically for joint replacement OTs, you have to have 18 plus minus 2 degrees. And the corresponding relative humidity has to be between 20 to 60%. Ideally is around 55%. These are the devices, some of the devices. One is a higher end device, surgeon operated surgeon panel. These are some of the cheaper devices which we have to monitor and display in OT. You have to keep a check of this. You have to ideally keep a register checking the humidity at least thrice in a day, early morning, mid afternoon, and the late night. So what are the effects of the humidity on our C-arms? If there is increased humidity, it causes water condensation on metallic surfaces like the circuit plates of the C-arm, especially the IC or chip-based cards like the filament cards. So which when get exposed to the environment, they cause defective signal generation, which are very and these cards are very difficult to get available, not available easily in India because they're odd number, and so that is the reason for this costly repairs. So and it also causes defective signal generation. Another thing it causes is increase in the infection chances by increasing the fungal growth in the OT surfaces. So how do you prevent infection spreading? Everybody knows by maintaining the air quality is one of the most important factors in our OTs, by maintaining the temperature, humidity, flow pattern, and the particle count. Along with this, short circuit chances are more if the humidity is more in our OTs. So these are the effects of humidity as was seen in some of the filament cards, the salt and water deposition on the filament cards. This is the control panel of my C-arm. So you have to maintain the atmosphere by maintaining the air quality of the OT and along with the record for the pressure, temperature and the humidity of all the cases, which is very important medically also. So thanks to Dr. Rajesh Gandhi sir for providing with these images. These are the portable dehumidifiers, which are basically condensation coils. For a OT size of around 20 by 20, you require at least 2 dehumidifiers of these, which has to be kept on a stool with a bucket below for the water to get collected. And this has to be used continuously between surgeries and in the between the surgeries also. But these are expensive, but it has to be used. Along with that, nowadays air handling units are used in many OTs, but you have to ask very specifically for AHU with a dehumidifier because they are not regularly provided by the companies. So it has to have a minimum total air changes of around 20 based on the biological load and location, with fresh air component around minimum 4 air changes. And ACs, as per the newer NABH guidelines, either window or split AC should not be used in any OT because they are pure recirculating units and they have got pockets for microbial growth, which cannot be sealed by any way. So ideally, they should not be used in any OT. So NABH has classified for all practical purposes OTs into two types. One is a super specialty OT and another specialty OT, wherein the air quality remains the same in both of them except for the temperatures, which has to be maintained as I previously told, 21 plus minus 3 for super specialty, and for specialty like the joint replacement OT, it has to maintain at 18 plus minus 2. So what are the recommendations with regards to humidity? I have searched the whole of the internet and I was able to find these. The government of Maharashtra has very specifically, given recommendations for maintaining the operating as well as the storage conditions. Storage is one of the most neglected things of our C-arms. because where you keep the C-arm also plays a big role in how it is going to function. And especially, I had a lot of issues during, like one of the cases I was doing a PFN, the wire was inside the hip screw, the C-arm got shut. So that was the issue I had faced once. So these are the ambient temperature and the relative humidity you have to have when you're operating 5 to 50 degree while operating and relative humidity of 80% around. Whereas the storage condition has to be around 0 to 50 degrees centigrade with the relative humidity of 50 to 90%. So thank you for your attention.